Good afternoon, this is Dr. Do again. This video is Quarantine Special Edition, video number 32. Today I'm going to talk about the Center of Care, which is the part of the, I name it the art of medicine. It sounds very strange. Medicine is a science, how come it's art? Actually, medicine is a combination of science and social, politics, humanity, and together to compose a art of care. Really, if you see a patient, if you only manage a disease, that means it's not the true medicine. From my understanding of medicine, the true medicine is you treat patients individually, individualized, and to know the patient deeply, not just the symptoms. Like for example, the patient tells you he has the headache, and then you just only manage the headache, the head part, ignore the whole systemic causes of headache. Or if the patient has the ankle pain, only look at the ankle, did not look up. So this is not the true medicine. The true medicine is take any of the complaint, any of the problem, look at the beyond that small problem. Like I said, the headache could be caused by the systemic, not from the head, but the high blood pressure. Very simple, straightforward cause. But this is what I mean about the art of medicine. So, if you think about the communication, first of all, this is one of the art component, is the communication. I probably not in the position to talk about this, but I find the communication is so critical in terms of communication with patients, communication with other professionals, or communication with the staff or nurses. So this is a multiple stratified, multiple dimensional structure. If you consider, for example, communication with the patient, one patient is immigrant with limited English capacity, and the other is your friend, the same as your level, PhD or MD. The communication for these two people among this physician and patients is totally different. You need to use slow speed, even interpreter, if no interpreter need to use common language, simple language to break down the medicine into a common life words for common daily life, so the patient can understand. However, if you use this language, talk to your PhD or MD colleagues, then make you look totally bizarre situation. So this is one layer of the communication, one layer of the art component. The other layer is, like I said, treat the disease, not the patient. This is not a true medicine. The true medicine is treat the patient on top of just the one complaint, to really digging out what is the true cause behind this headache. If the patient comes here, for example, 65 years old, a patient complain headache, come to your clinic. If just this is old-fashioned, or it's just a scenario makeup, you just treat the headache, give medication, go home. And then turns out it probably is a disaster because you need to work up, do a whole systemic workout to make sure either diabetes, hypertension, or any other migraine, any other causes, or depression. Many causes for this headache. So this is treat the disease or treat the patient. This is another component of art. And the third component of art is the individualized. Medicine is individualized. Like I said, for example, the two patients, both of them had hypertension, and one of them probably is sensitive to beta blocker. The other one probably is sensitive to diuretics. So this is the individualized management. The other part, the other layer of true medicine, the other layer of art. So how do you identify those? This is from experience. optimal or previous experience or the data. Of course, the most important is evidence-based practice of medicine. These are the different level of evidence and the guidelines. So these are the component of the other layer of the artistic part of the medicine. So this is just about the patient and doctor's communication, and the physicians among the communication among the physicians, the specialist, the general practitioner, and also the lab, the imaging. So these are another layer of the communication which involves the art part of the medicine. So beyond this, and there's another layer, relationship between the physicians and the staff and the nurse and the billing, the front office. So this is another layer of medicine. So if the patient, the purpose for this talk is for those patients really pay attention to their health. This is great. I have to acknowledge that. Follow the doctor advice and seeing physician regularly and take the medication on time, on schedule with note. Actually, my mother was that kind of patient. Unfortunately, she passed away. She is a very very good patient, compliant very well. Even though she was very busy, she has to take many pills, but she just with the list, the separated each day 3 meals, what kind of medication, never missed anyone, and always follow up with physicians. So this is these patients it's great, very compliant with the physician's advice. We acknowledge that. We encourage you to do so continuously. At the other, on the other hand, there's some patient like to question why he used the diuretics, why I use the beta blocker. So the purpose for this video is to explain individualized of medicine. For those patients, if you have questions, discuss with your physician and realize that medicine is individualized. It's treat the patient, not just the disease. If treat the disease, so everybody get the same medication, diuretics or beta blocker for unified, is not, that's not the true medicine. So this is the video is very brief. I was thinking about the quarantine special, and I read some literature on how to practice medicine as especially the transition from the regular clinic to the telemedicine. So this will probably has another layer of art, how to practice medicine. I think to me, as a foreign speaker, communication is a big barrier, but we're trying to do our best to slow talking, try to be professional, and try to explain to those immigrants like us to speak slowly and to communicate with the patient and encourage them to comply with the physicians. So this is the video for general for the patients, either you're immigrants like myself, or if you're high educated physicians or the PhDs. In terms of medicine, the art of medicine, that's what I think, and I hope you can have your opinion, and if you could leave a comment on how really to practice medicine as a art, composing a piece of art, in terms composing a medicine in the level of art. So that's the that's how I understand of medicine, of a true physician, how to treat your patients, to treat your to treat their disease, treat patients, and to care the patients. So this is the video for this quarantine special, and I thank you for watching, and I will see you next time.